Is US healthcare that bad? As long as you don't have a chronic condition and have decent insurance, you should be fine. It is true though, if something catastrophic happens, cancer, surgery, etc., the costs can easily bankrupt you. I did an ER visit when I felt chest pain. I got an EKG and a doctor spoke with me for about 15 minutes. I mainly sat on a bed for about 3 hours. Also, I got an X-ray of my chest. Turns out my heart and chest was fine, and it was anxiety that made me feel like I was going to have a heart attack. $2,000 with insurance. I took my daughter to the doc for an ear infection. It cost over $1,000. I had strep throat. It cost nearly $500. I pay almost $1,000 a month for health insurance, but it still costs crazy high amounts anyway. As far as wait times, I needed a minor surgery. I called for an appointment, had to wait 6 weeks for a consult. At the consult, I had to schedule a real appointment. Another 6 weeks. Appointment scheduled a surgery, but I had to get a blood test. Blood test was at a different lab. 4-week wait. Blood test was okay, but I had to pick up the results by hand and deliver it personally. 2 more weeks. Surgery went okay. Cost about $4,000 out of pocket, even with insurance and being my own delivery boy. US healthcare is awful. Yes, even with many insurance plans, things are overpriced and make you go through tons of hoops and red tape to ensure you don't get screwed over. We have a great healthcare system in terms of infrastructure and quality of care competence, but it is insanely high without insurance. My max out-of-pocket expense, what I will have to pay, is maxed out at $7,000 a year for my family and $3,000 for the individual. This doesn't include vision or dental, and insurance sometimes denies claims, meaning they refuse to pay the bill because they deem it unnecessary or wanted you to try something else first. I also pay in like $300 a month into my company's program. My company pays the other $900 a month. I went to the ER and have 2 insurance plans and it still cost me $2,000. It's expensive. Insurance might help, but that depends on the insurance itself. I've heard stories of Canadians just traveling to Canada for healthcare when they need it to avoid paying US prices. I'm guessing you have a fairly well-compensated job. If so, you will likely have good health insurance coverage. Your employer will likely pay most of the health insurance bill, and you may have to contribute a portion towards your health insurance premium. You will probably also have a choice of plans, for example, high-low deductible, etc. You also may have the opportunity to contribute to a tax-deductible health savings account (HSA). The nightmare stories you hear here are from people who have no insurance or who are very underinsured. Most people don't pay anywhere near the full price. The insurance picks up most of the tab, which is usually lower than the list price, and the patient pays a deductible. A few years ago, a friend of mine tore his ACL playing basketball. He was seen by the sports medicine doctor that same day and got his MRI done immediately. He was seen by an orthopedic surgeon the same day and had his surgery done a few days later. Chances are in Canada, it would have taken weeks to get an MRI and even longer to get the surgery. That being said, in Canada everyone has access to this healthcare. Had my friend not had any health insurance, he would have had to rely on charity care or receive no care at all. This summer my kid got kicked off our insurance because of an error. She broke her wrist right when it happened. It took us months of chasing various leads to figure out what happened. It was not our fault. It was entirely the fault of a glitch in the system we bought our insurance through. We had to pay $1,500 just to get her back on our insurance and had to petition to get most of her bills forgiven. In the middle of this, I had to go to the emergency room for stroke-like symptoms. Wasn't a stroke. Due to the potential severity of my symptoms, I had to go to an out-of-network emergency room. I had to pay $1,500 just to get in the door. I talked to a doctor for all of 10 minutes after waiting for around 6 hours to be seen. I was billed $8,000 and my insurance refused to cover any of it because I was out of network. So the US healthcare providers, people who actually do the healthcare, I would say are some of the best in the world. But our insurance companies are evil bastards who should be subject to the worst tortures the devil can devise. Yes, my family has military insurance, and it's so shit they refuse to cover so many things, and then when it's something they should cover we have to call them a million times to get them to actually pay it. Fuck TRICARE. Let me just put it this way. My little brother was both a few weeks premature and needed a couple weeks of neonatal care in the hospital. This cost my parents thousands of dollars after insurance, and they ended up deciding declaring bankruptcy was their best option. Most GoFundMe campaigns are to pay for medical debts, and medical debt is the most common cause of bankruptcy. You'll be fine if you don't get seriously sick or badly injured, but have no doubt, the US healthcare system is an absolute shitshow and a national embarrassment. When you read all these responses, remember it is not who US healthcare works for, but who it doesn't. There are many situations, typically the more expensive, that it doesn't, and insurance companies try to pass the buck to the consumer. It's a shit show. I'm an RN who's worked in healthcare for the past 15 years. For whatever reason, our maternal mortality rate is ridiculously high and have been increasing for years. We're ranked worse than Syria and Uzbekistan right now. Your family shouldn't expect any mercy on the bill if they kill you either. Insurance here is not as bad as people say, it's worse. A procedure that would cost you $35,000 in Germany without insurance will probably cost you $20,000 in the US. But don't worry, your friendly insurance company, assuming you have insurance, will pay $9,000, meaning you're still on the hook for $11,000. That will be covered by you, depending on your co-pay, which may be as high as $9,000. So yes, you will pay around $9,000 out of your own pocket for something that costs around $35,000 in other countries. If you are insured with decent coverage, it isn't the end of the world and get great care. I had 2 stints in the hospital. One was for 30 days and the second one was for 2 weeks. I had a total of 4 emergency surgeries and was in the ICU step-down units for 3 weeks of the first stint. The care I received was phenomenal. I had my own room, excellent surgeons, nurses and aides. For my second stint, I was able to eat more and was allowed to order my lunches and dinners off of a menu that was provided because I didn't like what they scheduled and sent around. Upon release, I had in-home nurses, 2 wound vacs, and multiple follow-ups, CT scans, etc. I have $5,000 max out of pocket. I don't consider $5,000 chump change, nor do I consider it bankruptcy territory. The only thing that sucked was I had to pay it twice. One stint was from Dekshan and then the next stint was in April. However, because I had racked up the entire total that January, I paid nothing out of pocket for the rest of the year. If you're rich, well-off, top government official, or some other privileged individual group, it's great. If you're not, then it could be up to the whim of the insurance company to see if you're worthy of care. I do feel like the US has reached a point where corporations are or will be able to determine if you're worth keeping around or not. Don't get sick here. You can't ask your employer about the health insurance? What kind of multinational company is this where they don't give you specifics? I don't understand why nobody is giving you the actual answer. It depends on the state. You can't get a good answer without specifying which state you would live in. Different states regulate healthcare and health insurance differently. This radically affects what kind of financial risks you are exposed to as a health insurance customer. It also affects the level of competition in the healthcare market, which heavily influences quality of care. The fewer the options, the closer to a monopoly, and the lower the quality of care. Secondarily, it depends on the policy you get. If you get a high premium plan that offers low deductibles and high coverage levels, you will get what you pay for. If you go for a low premium plan that covers much less, thinking, what are the odds that I will actually have to cover a major medical cost? Then you might regret learning the actual answer.